ABC 15 exclusive investigation. A whistleblower coming forward to expose troubling new details about a young patient's death at the Arizona State Mental Hospital.
Yeah, Chad Taylor was a supervisor who worked directly with patients and says the hospital is as dangerous as ever. Tonight, he's speaking only to ABC 15 investigator Dave Biskobing.
The only way I could best describe it to you is like playing Russian roulette. A lot of staff members just hope and pray.
Chad Taylor just quit after working for a year at the Arizona State Hospital.
How long have you worked in this field?
15 years.
But in your 15 years, this is the worst?
The worst.
He's coming forward to tell us the things he's witnessed and expose things he says the public needs to know.
I'm risking a lot. I'm risking never being able to work in the field again.
It's worth risking your career.
It's more than worth the risk. But that also, in turn, ought to let you know how strongly I feel about what's going on there and how bad I want things to change.
Things he says put everyone here at risk.
It's a ticking time bomb. It's certainly not safer. That's administrative spin, and we saw a perfect example of that with Chris Blackwell.
Patient Chris Blackwell died September 8th last year. Just 23 years old, he was supposed to receive around-the-clock care to prevent him from swallowing dangerous objects.
Fire department, what's the location of your emergency?
News of Blackwell's death prompted a federal investigation and caused the hospital to close its ranks.
Mr. Humble, you got a second?
The state won't answer questions about what happened, but Chad Taylor will.
You were working with Chris the
Yes,
day he died.
I was. I was there the day he died, the shift he died.
This is the incident report I got from the state hospital about his death. Not much information there, is it?
No, that's intentional.
According to the state, Chris Blackwell collapsed while drinking an Ensure shake and was transported to the Maricopa Medical Center.
How much of the story does this tell with what happened to Chris that day?
Next to none of it.
What's missing? Taylor says he and other staff were told to stand down when they could have stepped in and possibly saved his life.
Days before this incident, you saw him eating CDs.
Yes.
And you were told not to stop him.
Yes, he had, Chris had the CDs in his mouth. There was a code that was called. He hadn't swallowed them at this point. He had put them in his mouth. And as staff were trying to take his hand away from his mouth, we were told to no, he's going to swallow them anyway, and we'll let the medical side of things handle it.
But the feds would find the medical side failed. They never followed up with Blackwell, missing the severe stomach infection that would soon kill him.
Let's just sum that all up. You believe Chris should still be here with us today.
He should be here today. It's the hospital's responsibility to provide a therapeutic and safe environment for these patients.
After Blackwell's death, federal inspectors cited the hospital for severe staffing shortages and not properly monitoring at-risk patients. Officials promised to fix those issues in order to save their certification.
Not only did they not fix the staffing issues, it's gotten worse. It's gotten worse.
And Taylor and others believe the administration is misrepresenting staffing levels to federal inspectors.
Cooking the books. I think that they're adjusting the numbers to suit their needs.
Sources tell ABC 15 it's still a revolving door at ASH. The violence and danger is too much for the staff to bear. Taylor says the group of new workers he started with proves it.
There's about 20 to 24 people, I believe, that were there to start during the 2-week orientation.
A year later, how many are left?
After I left, 1.
1 out of 20?
1 out of 20.
Top state hospital and health department officials have repeatedly refused or ignored interview requests. Taylor says it's the indifference that drove him away.
I haven't seen anyone improve. It's a stagnant facility. It's a violent environment. The morale there of the staff members, I mean, it's just next to nothing.
How about the morale of the patients?
Equally as low. They feel unheard, uncared for, and that's just not what I signed up to do.
I'm investigator Dave Biskobing, ABC 15 News.
And Dave Biskobing has been investigating the Arizona State Hospital for more than 2 years now, and you can find all of his reports on our website, abc15.com.